Good afternoon and welcome to the March Department of Social Services Board meeting. I have to stop and think, what month are we in? Everyone is present, so I would call the meeting to order and observe a moment of silent prayer or silent meditation. Amen. According to Susan, we don't have anyone signed up for public comment, so I would, unless somebody has changes, accept a motion to adopt today's
I
agenda.
so move, Madam Chairman.
I'll second.
Great, thank you. The motion as sent out for the March 10th meeting has been adopted.
I move to
And-
approve of the minutes as mailed, Madam Chairman.
Okay. Do we have a second for the minutes as mailed?
If there are no corrections,
second.
please.
All those in favor of approving the minutes as submitted in our package, please say aye.
Aye.
Okay, great, thank you. The next item on the agenda is our items for consent. We have some budget amendments prepared by Angela Hart, the business officer. One is Energy Neighbor Funds, recognizing $172 in donations, and the other is Neighbor to Neighbor Funds, which is GUC, $10,000. If we bring these funds in, then Angela and the programs can use it to help folks in our community with their utility issues. I would accept
I
the
move to
motion
approve of the budgets as
as presented.
recommended.
And I'll second.
All right, it's been moved and seconded to accept these items for consent. All those in favor, please vote by saying aye.
Aye.
Next, we have items for report. Inside your agenda, you have the social work proclamation, where we are recognizing that this is Social Work Month. Jan, would you like to read the proclamation for the record?
Certainly. Whereas the primary mission of the social work profession has been to enhance well-being and help meet the basic needs of all people, especially the most vulnerable in society. Whereas social work pioneers have helped lead America's struggle for social justice and paved the way for positive social change. Whereas social workers, more than any other profession, recognize that more must be done to address persistent social problems. Whereas social workers are change agents who put the ideals of citizenship into action every day through major legislative, regulatory, and social policy victories. Whereas social workers support diverse families in every community, understanding that individuals and communities together can bring about group change. Whereas social workers continue to work to improve the rights of women, African Americans, and other ethnic minorities and the LGBT community. Whereas social workers apply their research and legislative advocacy skills to transform community needs into national priorities. Whereas social workers know from experience that discrimination of any kind limits human potential and must be eliminated. Whereas social workers know from experience that poverty and trauma can create lifelong social and economic disadvantages. Whereas social workers help people in every stage of life function better in their environments, improve their relationships with others, and solve personal and family problems. Whereas all children have the right to safe environments and quality education. Whereas dignity and caregiving for older adults help define a nation's character. Whereas veterans and their families need community support to ensure successful transitions after service. Whereas access to mental health treatment and health care services save millions of lives. Whereas research shows that all people, no matter their circumstance, at some time in their lives, may need the expertise of a skilled social worker. Whereas social workers celebrate the courage, hope, and strength of the human spirit throughout their careers. Whereas the National Association of Social Workers is celebrating its 60th year in 2015 and is an organization committed to supporting the social work profession and bringing positive change to American society. Now, therefore, we recognize in recognition of the numerous contributions made by America's more than 600,000 social workers, we would like to, I'll let you take over from there.
We, the Pitt County Board of Social Services, do hereby proclaim March 2015 as National Social Work Month and call upon all citizens to join with the National Association of Social Workers and the Pitt County Department of Social Services in celebration and support of the social work profession.
Move approval and adoption.
Okay, do we have a second?
We have a second and an amen, because if this were ever true, it is the gospel.
So therefore, all those in favor of adopting this as the Social Work Month please let it be known by saying aye.
Aye.
And I do think that throughout this month, Jan was telling us that they are doing activities for the staff, and they get motivational emails every
Right.
day, and they've got a luncheon scheduled at the end of the month,
And the board members will be invited to that luncheon, so
we'll get
if
an email?
you will get something to invite you, and so we hope you all can come.
and on behalf,
Tentatively.
on behalf of this board, I said that we would be glad to provide dessert at that meeting, so,
And-
at that
did?
luncheon.
And Ms. Perkins is going to bake it.
Oh, my goodness.
Actually, I
And
said.
I'll help decorate
I
it.
said we would come up with a way to provide the dessert, and I hope you all will join me in doing that.
We'll do it.
But I did not offer anybody up to bake it because I don't have a kitchen.
I'm
so-
offering that.
Thank you. So
So,
kind.
Is this for all 600,000 employees?
Yeah, really.
This is a smaller group.
I'm thinking more like a large sheet cake.
My, we in a rare mood today.
But Jan said when they got all the details worked out, she would get back with us
Right.
and let us know what was going on with that.
Will do.
Anything else you would like to add, other
No.
than our sincere appreciation to each and every employee that works on behalf of the citizens in our community?
Thank you.
Next item up, Gwen Burns, energy update.
Okay, the Crisis Intervention Program, which operates across the river at the Human Service Center, we are currently out of funding for that program. There are no funds available at this time, and we are not expecting any additional funding this fiscal year from what we're being told. The Low Income Energy Assistance Program, LEAP program, we will be operating until March 31st or until we are out of funding. We began the program with $1,097,372. As of yesterday, we had remaining $75,772. Total households approved are 3,615, and total funding spent is $1,021,600. Total number denied is 529 households. The program is currently operating in our off-site location at 1710 West 6th Street, and it's also operating at the Human Service Center. We're taking applications for those clients that come to the Human Service Center at 203 Government Circle. The community partners are no longer taking applications, but we are at the two social services sites. So you have
That's right here and over there.
on 6th Street, the building on 6th Street, the
Okay.
LEAP building at 1710 West 6th Street, and at 203 Government Circle across the river. We are taking applications at both of those sites now. So we are operating until March 31st or until all funding is exhausted.
Thank you.
May I ask a
Any
question?
questions for Ms.
All right,
Burns?
Glenn, I'd like to know about how many children do we have on the waiting list now for child daycare centers? On the waiting
Waiting
list,
list for daycare.
that we're not serving, that want to be served. And are we up to the
Well-
8-year-old, or what age group are we now? You know, we cut back on it one time.
Okay.
Where are we standing on that?
Right now, we're serving all the children that the state allows us to serve by age range. Okay, so we are serving the older school child under the age of
You
12.
don't have a waiting list at
We
all?
do have a waiting list, yes, sir. We have, I'm guessing about 1,600 or 1,700. I didn't
what
come
I thought.
prepared to talk about that, but we're not, right now, we're not accepting a whole lot of new folks on
Yeah.
because we have that waiting list and we're spending all the money that we have. And I don't know if Angela can add to that or Margaret.
All right, as we get these, and this has always been a concern of mine, are we picking out those that are in the most needed?
We have to do it based on first come, first served.
Well, that's not,
And,
that's not.
well, we are
I
not
mean,
allowed.
I know you do it, but,
Right.
you know, you got, say you got 10 families out there, and you might have 2 families that are desperate needs. I mean, they really do need it. But then you got 2 or 3 that, maybe more than that, it's on the borderline, so to speak.
Well, we are not allowed to pick and choose based on need. We can set priorities for service, and we have to serve all the folks in that priority before we reach down to another priority. But if you are within the particular priority group that we're looking at, it doesn't matter where you are in that priority group, it's totally based on date of application.
Okay, all right, so that one, I've been thinking about that, and that's no good to be thinking about it.
And if you need more information, I'll be happy to pull that for you.
No, if
Okay.
that's the law, that's the law. Okay?
Any other questions for Gwen from the board?
When does the old budget finish and when does the new budget begin?
For
For energy?
energy or just in
The
general?
overall,
July 1 is the new fiscal year for the county.
thank you.
Brian, NC Fast update.
Good afternoon.
This is mine.
The report on activity in February for Medicaid is on this PowerPoint. And, excuse me, in February, Medicaid applications, we processed 334. We took 459 Medicaid applications. We have 1,420 Medicaid applications pending, 382 are past due. Reviews which are due by March 31st, 5,026. In February, we completed 2,149 Medicaid reviews compared to 1,089 in January. So the staff did a commendable job in working on the reviews in February. We lost about 21 hours due to early closings or delayed openings. And despite that, almost 3 work days, we were still able to complete 2,149 reviews. As of March 10th, staff have completed 1,091 reviews. And at that rate, 7 work days, we are averaging about 156 reviews per day at this point. And that comes to approximately 3,120 reviews, Medicaid reviews per month if we keep it that rate. We have not fully realized the new staff that have just been hired. They are already involved in the process, but we're training them and have them involved in the keying process, cleaning up the person pages, the personal information on clients that has to be done in order for these cases to be converted in NC Fast. And we are continuing working with them on that because that's where we need additional help is with the keying the reviews. The prepping goes faster than the keying part, of course. And Ms. Witcher joined us last week and observed the NC Fast conversion process and the complexities of it. So she, I'm sure, can share with you a little bit about what she observed at some point in time.
Thank you, because I was going to raise my hand. Oh. It was such a privilege to get with this group and fantastic trainer, Mary Revelle. I think the main thing that she had to teach these and all of the trainees, I can't describe how impressed I was with their attitudes. They have this mission, they want to get it done, and there's so much frustration in the implementation of this software to start with. And by the time I went to 2 out of 3 days where I got the basics of how to, they have to go through the process. Well, from what I understand, to start with, before the NC Fast was instituted, was it about a 10-step or a 7-step process?
Yes,
10-step?
yes.
Now it's an 18-step process. And there's so much redundancy. And going from one program to the other, and maybe the person is approved one place, and you go into the other, and all of a sudden they're denied. And then you're back to basic, and then all of a sudden, it goes dead. And you're sitting there waiting for the computer to come back. And I was so glad to see these things and what in reality is happening to these people who are all trying hard. The more experienced ones were so good about sharing tips and tricks. I'm sorry, it's the software that's trying to trip you up. And they're saying that, so, well, try this, try this, try that. If you get to a roadblock here, try this, try this. And it's not a simple, it is not a streamlined piece of software. It's not the employee's fault if they, when the trainer says she took, she's going home with these cases, which we know, and on a Saturday, and this is the trainer, for one person, I think it was a 20-year-old gentleman, and it took her 7 hours at home with cable. There's something the matter with the software, with the implementation of this, that it's like we're being sabotaged to serve the people. And my concern is that, and one thing that Ms. Revelle was so good about was while we're sitting there waiting for the broadband or whatever to boot back up and say, well, think about what you, remember, you're still employed, your time here still counts. Think about what you can be doing while you're waiting for it to come back on again. And multitasking, and I'm thinking, well, that's good to multitask. As my profession is teaching, I had to learn about multitasking. But then I thought, you know, if you multitask so much and keep coming back, then you run a danger of your mind being split so many different ways. Then what is the danger of just honest mistakes because of that? We need to sit down and we need to see how we can talk with the state commission about streamlining this process. People without social security numbers should have to go to the end of the line. People that come in with the input information that applicant should be no problem for them to supply to start with, should be required before they ever have to turn the on button to start it. There should have to be all of this redundancy in inputting the same information over and over again. You ought to be able to put in a person's social security number, and all of that basic information should fall into place. I'm sorry, but I'm very disappointed in this program. I've done a little bit of background reading, and from what I can see, I haven't heard from anybody that had anything good to say about it. I know that some states have fired the company that produced it to start with and rehired another country to try to streamline and work with this. I'm wondering, what can we do instead of being the victims of this? What can we do to improve the situation so that our people can serve the citizens of Pitt County the way that they deserve to be? I hope I've...
No, Scott, all right, who's the head knocker up there in charge of this?
Okay, well, Angela Taylor is the head of NC FAST. Obviously, the Secretary of Health and Human Services would be over her.
That's who we want.
So,
We want the boss. You start at the top. Because something like this, I agree with you. I have been for 10 years ill with them because they have always, you do this form, you go and repeat the same people over and over again. It's been that way. So what you're saying, it hasn't changed a doggone bit. And if anything, instead of 10 you had to go, now you go to 18. So you're done worse.
what I will say is this system is still evolving. It is never going to be an easy system to operate in, but it is still evolving. The system does have moments when it is slow. It has moments when it's down. You have to do workarounds, but you know, it's still an evolving system.
All right, now, I want to ask this, though. All right, you got Medicaid here. You haven't got food stamps. All right, you got 5,026. How do we stand on food stamps?
Food and Nutrition Services Program is current, because that part of NC Fast was implemented first.
All right, so
And that's-
you're
we're
up
okay
on
with
that?
Yes, sir.
Well, I thought when the procedure was that we were going to combine the two, the same working people would be done, the Medicaid and the food stamps.
Well, in our intake process, when a client comes in, the same caseworker takes the application of all programs. But at the review stage, because of the complexity of Medicaid and the difficulties of the implementation, if we were to put everybody together right now, it wouldn't be, this is not the best. We're moving toward that, but we can't just do it all at once, because there would be a slower process even than what we've got right
A
now.
lot of this, Mr. James, relates to the original conversion of Medicaid, not new cases.
Right.
Yeah, all right, well, from what, Miss, what you said, all right, now,
That's correct.
this 18 steps, places that they were doing, why can't you combine some of those? Why do you have to go and repeat them? That's what I guess, Scott, that I need. Somebody evidently with authority need to get involved and get something done. It's got to be politics
Well-
to a certain degree.
You know,
It was implemented by the last administration, I think in 2010, is that correct?
it's been worked on and off for a long period of
It's
time.
been-
So a
this
lot
thing
of
has been-
administrations have touched
It's
it.
it's a mess.
I thought the system was not a system that we chose. It was a system that the state said we had to use.
Correct.
And must use
Correct.
for the citizen of Pitt County.
And they
Not
will-
something that we want.
And we will be adding additional programs into this system
Into
as the time goes
Well,
by.
my thing is just, can we affect policy, maybe through the Social Services Commission? Can we affect with other counties? Because this is not the only county, and this is brought out before. I don't know of any county that I've read about that had anything good to say. And if we could even streamline the applicants to say, these are the qualifications you have to have. You need, and illegal immigrants, from what I gather, are allowed to apply.
Now, those
you
are
have to
federal
have-
policies.
Right,
We are not allowed to
exactly,
touch
but-
federal policies.
But if we could say, you have to have a social security number, you have to know your date of birth, these things that are simple identifying information, they should come in with, to start with, so that the person keying it in doesn't have to do all the detective
Well,
work.
can they use that citizenship ID that is assigned to them instead of the social security number?
Do you mean to tell me you got people coming here that don't have a social security number?
The farmers bring in immigrant workers on a continuous
Well, you
basis.
get rid of them. They got a place out there, and all you got to do is go right out there. I just came from there this week. They can give you a social security number just like that, and everything there is about it.
Most of the folks have social security
They
numbers.
should.
They just may not bring it with them,
Well,
I
then
think is
send 'em
the issue
home.
that you're raising.
And what I'm
no.
saying is, instead of requiring the caseworker to do the detective work, why not make that something that the applicant coming in with their information, if you don't have it, then that's fine, come back tomorrow when you do have it.
That's exactly
Meanwhile,
right.
we're going to work with the cases that do have the easily accessible information
That's
to key
exactly right.
in.
That's what you
And
need to do.
Is that some kind of a policy that we can get approval to implement, just to be able to give these people a break to get through these? The other thing is, they're coming in through the internet applications.
Mm-hmm.
One thing is, they have no way of knowing, is this a bona fide application, or is this just a group of college kids that are just,
Well,
whatever?
we have to
So
work-
there's so many obstacles to being able to serve the bona fide, justified applicants. Surely there's a way that we can approach to get some sort of streamlining, and it would be nice if we could work with, the other counties to come in, because it sounds like we all are saying the same thing.
There are a couple of issues. One, of course, it is federal policy and federal law. We do have state law. We have court orders, And the court order has to do with the date of application and the fact that we are required to assist folks with gathering information that they may or may not have available to them at that time. Now, clearly, if we have all the information to process a case, we should process that case while we're waiting to get the other information. We shouldn't hold it until that second case finally brings their stuff in. We need to process them as we get the information. But we are required to assist folks with obtaining that information by court order.
You should have your social security number.
That's right.
You should have some form of identification.
You should.
We should, and that is a faulty piece of policy, in my opinion. And I think that should be something we ought to be able to act upon to improve, is some of these, because, you know, and some of these cases it's not just one person. It may be 5, 6, however many people in the family that may apply. And they have to go through this process for everyone for each case. Once again, Brian, I have to say, your staff is doing a wonderful job, and for these people to be able to take this in stride and say, well, this is all you do, well, try this then and try that. I'm just saying, somehow or other, we ought to be able to collaborate to see what we can do, just to streamline. When you walk in the door, you know these things are required, or else we will welcome you the next time you walk through the door with that information, out of consideration for all the other thousands that are applying.
The question is, are we advertising what the needs are when they come into the office? And another thing is there an integrated system out there? Because it sounds like it's not an integrated system, whereas one screen is talking to the other screen. Integrated system means when you put the one piece of information, no matter where it needs to pop up, it's supposed to slip in. And if the state said they were going to work out glitches, and they're going to hire 500 people, they told us that last year when we were in a regional meeting. So are we still having someone to work out the glitches? Because as Jan said, the system is still evolving. So we can't blame the people if we are supposed to be advertising, they don't know what to bring. But you can't carry everything around with you all the time, or you'll lose it.
I memorized my social security.
I do too. I memorized mine too, but you gotta show.
You gotta show proof.
You gotta
Right.
show proof.
And I do think there is a checklist out there that tells them
That's
what they are
what it is.
supposed to
There-
bring with them. But I can remember back several years ago where the social workers were tracking down the W-2s for them or talking to the employer. And I agree that at some point, personal responsibility says if you need to show proof of income, then you should go to your boss and get your proof, and I shouldn't have to call on your behalf. So I don't know how much of that is happening on their behalf. But I also recognize that the law says you will serve. And so sometimes you don't always get the luxury of saying, come back tomorrow when you've got that with you because you're here today. But I also think the county manager had his hand raised and wanted to say something.
Yeah, Ms. Ball, but you may have a client that's incompetent, that the social worker has to track all the
Right.
information down
Right.
for the client. But aside from that, I just want to make a remark about the FNS, Food and Nutrition Services, as well as Medicaid. Also, we're over the hump on food stamps, getting the processing like Brian was describing. We're working on the hump right now to get the Medicaid completed. I want to ask the question of Brian that if you were at March 31st and we had these 5,000 cases processed and we were up to date, how would the operating environment be under NC-FAST? Because this is the last major hurdle, right?
This is as far as Medicaid, and that's correct. This is it because applications, that was the first implementation that was done. Now this is reviews. So for Medicaid, this would be the end of implementation, but there are other programs that are going to be phased in.
This is the last measure. Basically what all counties are doing is transitioning from one computer database to another.
That's correct.
And sometimes you have to live in two worlds, two different database worlds while you're doing this, which doubles the work.
Correct.
My point being, once the transition is done, will NC-FAST be more efficient?
It has been as far as food and nutrition services is concerned. And see, with Medicaid, a lot of the labor-intensive data entry stuff that's being done is being done because the case is having to be converted and to be put into NC Fast. And like Ms. Wichard was referring to, if you have a household of 6 people, they have to go in individually and show each family member's or household member's relationship to each other. So it's it's not just a matter of saying, here's a list of the family, let it go. They have to go in and do each one individually. So the larger cases are more time consuming than a case with 1 or 2 people. But it is very labor intensive.
And the integration between programs is not smooth. As one of the things I observed is something was approved, they went through all the process, and you get down to this one thing, it says, now when you click, it's not for approval or not, it's just to say, now will you look at the information? And then you're still waiting for it to be approved. And even then, it may be approved in one of those areas, and then the same information is disapproved somewhere else, and you're back to basics again. So, well, let's try this trick, or try thing over here, or try this click and click. And luckily you have some good experienced people that are willing to share whatever tips and tricks they've learned. But everyone that I saw was so intent on getting the job done, and my heart goes out to them.
They are, and they're working together very well.
And they have wonderful supervision. And one of the things I admire Ms. Privet about Revelle is her say, well, this is just the way it is, and you just deal with it and go, because I think there are some people that just fling their hands up and, when you're trying so hard to help people, you shouldn't have all these obstacles that surely should have been streamlined before it was ever implemented to start with, in my opinion.
Okay. So I want you to do the math with me. 5,000 reviews due by the end of March, 2,000 done in February, and 1,000 done already. So does that mean there's 2,000 left? Because the February completions and the through March 10th completions come out of that 5,026?
The 5,026 figure is what's left after the 1,091 have been done.
That's what I was thinking.
That's what's left. That's what's
Okay,
due
so
here going
we
forward.
were still talking, there's 4,000 left to
You
do.
ain't gonna be up. You're not gonna be up.
No, 5,026.
Well, they will roll forward this month. This will be the last month of roll forward. If we can, again, as you see, each month, we're picking up more and more, we're moving faster and faster. But by the end of April, we should be really close to having them all done, because April is a small,
That's not April, it's March.
it says March, but I'm saying we're gonna get to roll forward what's left in March into April. And by the end of April, April is a month that has less cases to be done in. So if we, the projection now is, I think, what'd you say, Brian, a little over 3,000, 3,500 that you can do this month is what the projection is. And so then that would carry a couple of thousand
31.
forward, so,
Projection is
3120.
3,120.
right.
Well,
So-
what's the 3120?
So 3,120 of the 5,026,
Right,
leaving 1,900 to roll forward?
right. Around 2,000 to roll forward,
Yeah.
which would then add to what we've got in April,
That's
which would
correct.
have us at about
correct.
3,500, 4,000
And then you
That's
would
right.
process through
through the end of April.
in April, approximately 3,500, and
Right.
that's where you
That's-
think it's,
That's where we've got to be into being ready to individually review every case.
Will anything be behind in terms of recipients?
No, recipients are
No,
receiving their
they'll
benefits.
still receive the benefit.
okay, so, one more time, there's 5,000 that are due by the end of this month, and you've done 1,000 of them already.
Correct.
So that le-
I'm sorry, back up. The 5,026 is what's due from now to the end of March. That's what's left after.
That's net of the
Correct,
1,091.
after the 1,091.
Okay,
That's
so you're gonna
correct.
do approximately 2,200 between now and the end of
That's
the month,
correct.
if you double the work you've done so far.
That's right.
So that leaves you 2,800 to carry forward, plus
Correct.
April with it. Then you've got 2,800 carried forward, plus April, that you then think you can get worked in April.
Yeah.
See, I'm still
We're-
not seeing how we're gonna be current.
Well, there are a couple of things, and I'm not guaranteeing we're gonna be current, let me tell you, I'm not guaranteeing. But what I am saying is that with the increased staffing that is pushing, if we, because they're moving in, they're taking up, doing more work. We believe we will do more by the end of this month than we did last month, and we believe in April, we will be doing even more than we did this month. Will we have all of them done? Probably not. Will we be very close? Yes.
Okay.
And what I will say is that even if we do not make it, and this is a bad thing, and I do agree, we will make sure that the folks do not lose their benefit. We will automatically extend them an additional month while we finish up those, hopefully few that are left, okay?
And I ask it this way because I think one of the things that helps motivate staff is if there's some kind of charting that shows every month your carry forward's getting smaller, and every month your number that you process through gets bigger, so they see efficiency and effectiveness, so that, if the number is we do 2,000 more this month, which carries 3,000 forward, and then there's 1,000 in April, which makes 4,000, and we process through 3,000, then there's only 1,000 left. Or if we process
Correct.
through
Yeah.
3,800, then there's only 200 left. So that's the review side. Now talk to us about the applications. If in February you took in roughly 120 more than you were able to process, and you have 1,400 out there pending, how do we ever get that? I see the reviews getting closer and closer to caught up. Now
Right.
tell me how the applications get caught up.
Well, the applications piece is something we're having to focus on with the new staff that we've got working. We've got all of the intake staff that have been through training. They are in the intake unit, and they are working. They're part of the intake unit.
So your
That-
reviews are being done more by seasoned staff, and intake is being done by the new, because that's the
Well,
easier
we've
side
got,
to-
we have about, the 10 staff that were added in intake were added to about 20 that were already existing. So we have some seasoned staff in intake, and then we have 10 that are new. And the intake staff are working overtime. When they're working their overtime, they're focusing on the applications, the past due applications. Last month, we processed more. In January, we processed more than we actually took in January. February was different, which we did not. But that is something we're looking at, and the intake staff are focusing on that.
The applications overdue have fluctuated. We've been as low as 199, we've been as high as upper fours, low fives. They have fluctuated greatly based on what's been coming in the door, because you never know what's going to come in the door. We've also had the Affordable Care Act going on. We took a fair number of applications there, and I hesitate to say, but it's coming back again,
Right.
because we're going to open the doors to the Affordable Care Act, I believe, the 15th of March again, through the end of the tax filing season, so that folks who find out that they might have a penalty can have a do-over, so to speak. And that's my term, certainly not Congress's term or the government's term. But, so we're gonna have another influx again.
What is that date that it's
It's
gonna?
starting, according to what I heard last night and what I've seen several times, but the March 15th, they're supposed to open the door again to the Affordable Care Act, and it would run through tax season, which would be
About
mid-April,
last
late April.
So on these pending applications, are they pending for any number of reasons, or is it there's some kind of trend where people don't have their, back to Coral's comment about they don't have their information? And when it's pending, that person's not getting any services,
Now,
right?
that's correct. Now, of those pending, 382 are past due. The rest are within the time frame. It can be pending for disability. When somebody applies for Medicaid, and one of the requirements is disability, that's a 90 days application. Their medical records go to Raleigh. It's determined whether they meet the definition of disability, which we have nothing to do with that piece of it. So some are pending for disability. If it's a 45-day application, it could be pending. We're waiting for information that they have to provide back. Those are some of the reasons that an application could be pending. And many of those, we took in February 459. Some of those in that, are that recent. They're still within the time frame.
So some of those in the pending are your February applications, and inside of pending is the
Right.
overdue
Right.
applications.
And see, the Medicaid, the disability applications, sometimes they pinned up to 90 days, waiting for medical
So what's the
information.
penalty to Pitt County for overdue applications?
There's no financial penalty. They do look at our processing standards, whether we're meeting the processing standard. All 100 counties, they're looking at that. But to date, there's been no financial penalty. They
Other
have.
than doctors don't get paid and patients don't get seen because they don't have coverage.
That's correct. That would be right. But the 382 is what they are focusing on in their overtime.
And some of those could be overdue simply because they're waiting for like that disability.
That's correct, because they do sometimes go beyond 90 days. They
And
will.
overdue is defined as greater than 90 days?
Well, for a disability application. For a regular Medicaid that doesn't require disability determination is 45 days.
And they could be overdue in some cases because of an issue related to the NC FAST process. I know that we have 3 or 4 that I've been tracking for a while, that they're hung up, and I don't track them all, but I have been asking questions about a few of these, and have been told that they've got them in Raleigh, and they're trying to figure out why it won't process. So there's a variety of reasons, and sometimes it's, staff just hadn't got to it. There's a variety of reasons.
Mr. James, you had a
Yes. All right, you have 526. How many, if I've got a job to do, and most of the time, you kind of know how many of these come up, new ones, every month, approximately. Because I want to add that to the 5,026, and that'll be at the end of April then. So now, how many do you get each month, on the average, to take and to do?
You mean about how many Medicaid reviews
Yes.
on average? Anywhere from 1,800 to 2,200 a month.
All right,
That's an average.
and we're doing how many a month?
Well, based on 156 a day, if we keep it that pace, the pace we're at now, based on the first 7 work days of March, about 156 a day.
So you would be up.
So once we get caught up, we should be able to maintain the number of reviews we have on a monthly basis.
Because you
So you
can
can
do-
see the light at the end of the tunnel,
Yeah.
so to speak.
And that's kind of that chart, because at some
Correct. Yeah.
point, you're showing you have the capacity to process
Correct.
3,000 reviews a month, and the average month is somewhere between 1,800
That's
and
correct.
2,200.
So we'll
So
be
yes,
ahead.
you're gonna get there, but I think staff needs to see this number going up and this number going
Coming
down
down.
to show that, we're processing more, our carryover is lower, and that there is gonna be a day where our capacity is to do 3,000, and we only got 1,800.
That's right. Then the overtime, we won't have to put in the overtime in order to maintain it at some point.
But it may take another 6 weeks
Correct.
to get there.
That's right.
And we estimate it'll probably be July before, in talking with the supervisors, it'll probably be July before all of the conversions have been completed. So we're gonna have to do some of this extra work for right many more months on those cases that were in the old system, getting them converted to the new system.
Then we would have been through a full 12 months of doing
right.
But at
conversions.
that point where your capacity is the ability to process 3,000, and you only got 2,200 cases that month, then that's 800 capacity hours that you can divert
Right.
to working on applications as
Right.
opposed to reviews.
That's right, that's correct.
So you divert some staff time and effort to the other side of the process.
When you talk about that you'll be caught up, does that mean that we won't have any more paper?
No, there's still
Does
paper
that
being
mean-
used. It just
I-
means
I-
that the
you know,
case,
when I first found out about the paper files and getting it in, I was amazed that in this day and time in the year of computers, that we have paper files. So that's when we will get rid of the paper files?
But you know, that scares me, on the other hand, because I see what happens when the computer's down. And if everything is in the computer and you're paperless, what access do you have to the information you're seeking because the computer's down?
Right. In answer to your question, there is no answer to your question.
Thank you.
In answer,
I rest my case.
in answer to your question, we will have paper files for a long time.
Okay.
Because
Because at some point, we were told that we would.
Right. What is happening is all of the new cases that are coming in the door, as the case comes in or as a review is due, everything that's coming in at that time is going paperless. But we will have all those thousands of files that have got to sit there until they are able to be purged. And it's not particularly cost-effective to spend all the time it's going to take to scan them in. So at some point, we'll be able to toss them completely, but not yet.
Coral, did you have questions for Brian? You had your hand up.
You've listed here an average in an average month, but what happens March 15th when you get, what I'm envisioning, and maybe I'm out of, this is not the case, with the Affordable Care Act, with more applicants, renewed applicants, is that going to be an inundation of several thousand on top of this, whatever this average would be?
not at that level, I wouldn't anticipate at that level
Okay.
because I think we've received about 400 Affordable Care Act applications in this enrollment period already, so I wouldn't anticipate that level of application.
Okay, thank you.
Mary, anything else from you? Do you have another thought?
Well, yes, I really would rather, I got on my soapbox and all this stuff, but I really would like us to follow through on some sort of action we can take, if it's to, approach the commission, if it's to network with other counties, to approach as one unified body of counties, to get change, to get improvement in this process where we can.
Well, and Jan, is there a DSS directors meeting anytime soon where that could be something you bring up, that your board is supportive of? And then,
I'd like to make a motion.
okay,
Can I make a motion?
sure.
I move that we instruct our administrator, which is Jane, to take and to write up a resolution, the changes that should be made, that has been presented to us, and so that we can start the necessary steps to try to help solve some of these problems. That's my motion.
Can I just make an addendum?
Yeah,
That
I add to
whatever-
it. I mean, we'll
Whatever
discuss.
improvements need to be made, need to be done with the input of the staff.
Right,
Those
well, that's what
trainers
she's
and
gonna
Brian.
be working with the
They need to
staff.
be the ones to say, this is what's good, this is what needs to be changed. Without their input, I just don't think that's fair to that staff that's trying hard. They're the ones that have to implement.
And have the manager involved at the same time, too.
I
now.
have a
The
question.
county commission's got to be involved.
At one point, when I was at a regional meeting, they said there would be a clearinghouse. Do you have a clearinghouse for the problems?
The clearinghouse for NC Fast. There are help desks there that we use. There are people tracking those issues. They're elevating them.
Might not get us.
Oh, sorry.
Is there a second to Mr. James's motion? Then we go to discussion.
Yeah.
Can it be amended with what I've suggested?
Yeah, well, if you don't want it, I'm
Alright.
just, you
Okay,
want to
so
do something,
Mr.
that's the only
James'
way you're gonna get
motion-
something done.
Coral has
Well, you just keep
seconded
talking
it.
about it.
Now we can discuss it. Sorry.
I'm trying to answer the question, yeah.
I just want to make sure she's got it right over there.
We gotta get it right, that's right. Okay, so there are various committees with the Directors Associations, with staff members of agencies who work on problem-solving, reports, and other issues to give feedback into the NC Fast staff. So all of that is going on currently as we speak. And that is where some of the changes have come about already, is with some of those kinds of groups. It is a regular discussion at the statewide directors meeting that is every month. So there are
It's
some,
something they're aware of.
they're aware,
They're
there
aware
are a
of it.
variety of touch points, that kind of thing. So that is ongoing now as we speak, and has been ongoing for a while.
I have a final question. Do you think this motion is gonna make a difference? But having been through all of that, and I keep hearing of the problems that comes up in the regional, that we're not unique, and nor other glitches. I'd rather take action on something that we really can do, and we know we can do.
You're
Your
asking-
response?
Okay. I think that I certainly have no problem with raising the issue, and I think that the motion could do some of that. We could send it to the department and indicate that, but I think they're already doing a lot of
That's
what
I
this
said.
motion will
You brought
do.
it up before, haven't you?
We've brought it up, we bring
Madam
it up.
Chairman, I'll
to
solve
Jan.
the problem.
would
I
send it
withdraw
to-
my motion.
I would send it to the secretary.
I wouldn't, my
withdraw.
discussion involves is, but I wouldn't want them to think that our director hasn't brought up the problems and that's being faced in the county. I like this, because we don't want to say that we are ineffective, not pursuing what we see right. Let her handle it and go through the process, and then if she needs reinforcement as a board to
And
bring
maybe
it up,
that's
I'd rather do
the
that.
better is
rather than
bring
make
it
her
up
look
at the
bad
meeting
in the
with your
state.
peers, and if you need our support.
And what the secretary has said, and she said this during our last meeting with her, that anytime we have an issue, we can elevate it to the director.
I'd like to
So-
see you do it like
And we've
that,
done that.
rather than make you look bad.
Okay, so Mr. James's motion has been withdrawn. We will leave it where Jan will bring it up with her peers at the next
And you
directors
can make a
meeting.
recommendation for us to take that
Right.
action.
I would just like to see some way that the counties, because it sounds like this is statewide, for, according to what I've read, which is the tip of the iceberg. It would be nice if the counties could collaborate to come in and say, this is a unified problem. And that might have more clout than one
And
county.
when she's with all the directors from all the
And they
counties.
do that a lot already.
Yeah,
Yeah,
well, that makes sense.
Yeah,
if this was something new, I'd be jumping all over it.
Anything else for Brian? Thank you, Brian. Tell your staff, great job. 156 a day. Of course, we could always take 200. You know me, I always
We're
like a
gonna
little
send
more.
them we're gonna send them some dessert. So Susan said.
And no more snow days.
Next item on the agenda is Jan Elliott and the proposed budget for 2015, 2016.
I know, and Angela did my lovely slides, so y'all are gonna enjoy my slides here. And you should have copies of the slides, in your package, just so you can make notes if you want to. Because I'm hoping this will help make some sense of the big package that you got. And the first thing I wanna say is clearly that I do wanna apologize. The initial package y'all got, kinda came out at the last minute, and I did not get it proofed before it went to you, and we made changes at the last minute. And some of those changes got made in some places, but didn't get made in other places. So if you see some disconnects, hopefully we'll catch all those for you today. You do have the corrected pages in the blue packet that was left at your seat. So hopefully that'll take care of those for you. But let's start. Pitt County Social Services, we believe that we're about stronger and healthier families and individuals. We believe that we are about gainful employment and independence for folks, and that we are strongly supporting sustained well-being for our youth. you're getting fast with me here. One of the things I want to say about that is that I remind staff every time I see them, every time we have the chance to talk to them, that the work that those staff do helps people have access to food, to medical care, to basic resources, to help the children find those forever homes. Some of the folks we serve are temporary folks. They're not here with us long. Some are our older or disabled population, and we may be part of their ongoing long-term support system. So if you look at the proposed 2015-16 budget, first thing I want to do is say thank you to this board and to the commissioners for the support that they gave this department last year, because that was significant. But the total budget for this year from all sources, for all programs, is $351 million and change, as you see up there. The county general fund, what runs through the county's budget, is $33,860,105, and the county appropriation is $9.5 million. The actual county dollar increase is $291,631, or a 3.16% increase. The budget represents a significant economic impact for Pitt County. Over $264 million of that money goes to Medicaid or medical providers. Nearly $49 million of that money goes to grocery stores to pay for food. Over $7 million goes to daycare facilities. And so that should, that's just some of the way our money gets spent. And pulling those dollars from the hospital or from those daycare centers or those grocery stores would have a significant impact. In addition, the work of our staff means that nearly $14 million is paid out to custodial parents through our child support program. And recent figures that I have heard touted around about the economic multiplier, it's $4 for every dollar that runs through. So if you look at that, we are an economic impact of $1.4 billion on Pitt County. Now, certainly, that is tax money, but it is money that would not be spent in the same way that it is currently being spent had we not made that money available. So it is a very positive impact on the county. Our spending breakdown for the coming year is 68.9% federal, 28.4% state, and 2.7% county. So if you look at the federal, and I can't see that far, but it's $239 million. Mm-hmm. And for the state, it's almost $100 million, and for the county, again, $9.5 million. So a very small portion county dollars. So I wanted to share that with you. Another way of looking at it is we've divided up our dollar bills here, our $100, to show you again that the biggest chunk of this is federal money, a portion state money, and a very tiny part is the county portion. So moving along, some of our major changes are our documents management software. We have some strategic staffing changes we are proposing. The human services planner, social workers for the adults, transportation aides, and some program integrity staff. We're also asking for a general assistance line item addition. That pretty much has been cut out of our budget over the years, and we would like to put $25,000 back for those emergencies, and we'll talk about that in a minute. This budget is about improving the efficiency in the department, providing oversight, improving access and service delivery, hopefully reducing comp time, and protecting those vulnerable citizens that we all are charged with protecting. Okay, so looking at our documents management software, many of you have heard discussions about this for the last couple of years. They have been talking with this agency for a pretty good period of time. We are putting this in the budget this year. It was specifically developed for social services. It results in improved case tracking. We believe there will be reduced use of basic office supplies. Out in the field, staff would have real-time access to records, reduced manual processes, the ability to update records, ability to complete and sign documents, and the ability to conference with their supervisors. A time study was completed over a period of 4 months in 2013, and that determined that 75% of staff time in services is spent reviewing that paper that you were talking about. and collecting collateral information and completing documentation. Many of our processes are manual from start to finish. Until recently, we were still using a 3x5 file card system to look up previous reports for people for Child Protective Services. We are requesting from this year's budget $674,094 to get this started. We would receive roughly 40% or $269,637 in reimbursement.
Could you repeat that? I'm sorry.
It is in your package, but yes, ma'am, I can. Because we can do it as we go. $674,094 in this year's budget. I dropped off the cents. And you would be reimbursed $269,637, or roughly 40% of the cost of this from the federal government. I would point out that over 1/3 of the counties in North Carolina currently are using this system. And you will see on pages, if you look at your big packet that you got, about page 6 or so of that package, we talk about this system, and go a little bit further back. And we explain to you the cost of the system. We give you more of the documentation about what this system can do for us, and what the different enhancements would be. I think the enhancements are on page 7, and next year we will number the pages.
That will be wonderful.
We will do that for you next year. We will do that for me next year. Also, we have an example in your packet, and I think we're going to pop it up here on the screen. This is what's happened with Alamance County. Alamance County has bought this system. They bought it probably around October or so, started installing it, and this is what they have seen since they've done this. And you can see what happened before. This is what one worker reported, what happened before they started using this software. And you can see how that report, whoop, you were too speedy, ma'am.
Whoops, sorry.
You can see how that report, what the worker had to do. The social worker took the report, did a safety assessment, a risk assessment, got the camera, got all that stuff together, hauled out to the field. Then they had to maybe go back to the home to get pictures or proof of income or medical records or other documents. Then they needed to go get those birth certificates. I mean, you can see all the steps that they had to go through. And then when they came to a staffing on this case, they had to bring the files. And the files are frequently, many, many inches thick, and to discuss the case. Now you can do the after. After they bought this program, this software, today that social worker takes his iPad out to the field. The pictures and the documents, everything they do through that iPad. And then when they go to their staffing, they bring the iPad, and everything's right there. The supervisor can listen in on the interview if they need to. They can record the interview. There's a variety of things that can be done as a result of that. They have stated that they believe the investigations and assessments are completed within 1 to 5 days quicker than they were. The documentation is entered into files simultaneously. And it pre-populates. I believe that was a comment you had about the other. So it populates all the way through. They believe that their cost savings. Integrated. It's integrated. Cost savings in fewer resources required from the standpoint of paper, batteries, less travel time, less comp time, all of that kind of stuff. And this whole piece on Alamance County's experience is in your packet. So you can look at it again more closely if you want to.
I liked it.
But that, and most of y'all have seen what this has done. So this is what we are proposing. Anybody, we can keep going, or if anybody wants to stop and ask questions, we can do that.
Is this something that Margaret Dixon,
Yes, this is the system
is
that
this
they've been
something maybe
supporting.
she could give some input as well?
Sure. She would like you to do input on Compass.
Thumbs up, okay.
If you want to see it live working, you can go right down to the also, and you can view it if you wanted to, and I think they're giving some demos on that.
Would she mind coming
Yeah,
to
come
the
to the
mic?
mic.
I'm sorry, I have a moderate hearing. My husband complains at me all the time.
If you wanted to see it live in operation, you can go to Beaufort County and see it. They have it also. hear what they have to say, but you can actually, like the experience you had across the river, you can actually go be part of that experience. And I think if I'm not mistaken, they're still registering for a demo that they're doing in Beaufort County on that.
The demo is not the piece that she needs to see. We're doing a sidebar on that. The
Okay.
demo is for some other things that they're doing.
Well, I
So-
actually have, great faith in your experience and your knowledge of it and your rating, your recommendation.
Your thumbs up works.
And thumbs up was good for me.
Yeah.
It's just-
Yeah,
All in
Lenore,
favor?
yeah, Lenore County, Beaufort County, a lot of counties already have this. Over,
I've been in on a little bit
Yeah.
of a presentation of that a few
Yeah.
months ago. I just couldn't remember if that was the same program.
right.
Okay, thank you.
And other counties, you said a third of the North Carolina counties are on it. Are they big counties and little counties? And I guess I don't want us to go on as the big fish because we have the highest caseloads and then find out the volume it can't support the volume.
All size counties are using
Okay.
this, and they're using it in a variety of other states also.
Okay, just making sure.
Okay, and this is a documents management process, it is not a case management process. NC Fast will be our case management process, and this does connect with NC Fast because they have already done that in Beaufort County because they were using it for cash assistance and Medicaid as well as for their services. So from that standpoint, this is a good fit at the point in time we go with NC Fast for the next phase. Okay? Okay, so if that's all the questions about or where we are with that, the next thing would be the general assistance. We feel very strongly we need to reinstate some line item for critical emergency needs. In the past, I believe we had as much as $100,000 in this line item. Right now, I think we have maybe the size of my little fingernail for emergencies. So we really need to bring this back. We are asking for $25,000. The priority for this would be for our aged and disabled because they have very limited emergency resources. So many of our programs that we can use for emergencies talk about families and children. And so they're not really available for those seniors and those disabled folks that don't have children. We would make this available clearly to throughout the entire agency, but particularly our Adult Protective Services Unit. Yes, ma'am, you look like you need to say something.
Temporary disability,
Would be-
like someone fell, broke a hip, and they have to mend. Is that in this?
Not really. This would be like a one-shot, little emergency kind of
Okay.
thing, like we might help you pay your rent one month.
So where you get with the other?
You don't. One time, things like medications, maybe pay your light bill sometime or something like that. That would be what we'd be talking about with this kind of money. We have had situations with NC Fast where we had approved them, but for some reason they were hung up in the system. And so this would be something that we could help occasionally. We had somebody who needed insulin, and they were hung up in the system, and we couldn't, they needed their insulin, and it was like at the end of the month, so they'd already spent all their money, and so we bought them a couple of weeks' supply of insulin. Angela found us some money somewhere, but we don't truly have a line item to do that kind of thing anymore.
And this would give it to you?
This would give us a little bit. We'd have to be very frugal, but yes, this would give us a little bit. The other thing, and I hesitate even mentioning this, some of you may or may not know, that we have to handle unclaimed bodies. If there's an unclaimed body, social services has to handle that. And we have already spent all of our unclaimed body money for this year, and that
Maybe
takes
it was
care of that.
Because I saw that in the package when I read it. I just think unclaimed bodies.
It's not that many. I think we pay about $300 per body for disposal.
Yep.
And we only had 2,000 in the budget, so it's not a huge number, but we have already spent that money for this year.
We have a lot of people.
Not a lot. Again, that's not a huge number when you think $300 and 2,000
Just
total.
never know when
You just
when you're
never know
gonna-
what's gonna show up.
I was
And-
surprised at that. That's
Yeah.
all.
Yeah.
I guess I shouldn't be surprised nowadays, but.
No, you shouldn't. Not around here anymore. So that's our general assistance request. So now we start moving into our staffing request. We believe very strongly that we need to establish the position of a human services planner. This agency is very data-driven, particularly in our children's services area. right now, data is pretty much an add-on to everybody's job. And we need to be doing a lot better in the evaluation, in the developing our data, in working with our outcomes, in making sure that we are, doing the best we can with our business processes. How do those need to change? Are we best positioned to serve Pitt County citizens? Are there things that we need to be doing that we're not doing? And this data could help us then also perhaps pursue grants to go in directions that we need to go, a variety of things. There are a fair number of agencies that have this kind of position. Some have multiples of this kind of position. And there are certainly some agencies nearby that have this kind of position. We think it needs to become more at the forefront of our department and less, again, as an add-on. For example, if we are going to go in through, since we're going into a strategic planning process, right now, there'll be a couple of us trying to get all that data together, get it put together, handle everything, and it's, like I say, an add-on to everybody's job, and to get the best for what we're trying to do, we need to do this. The salary I have listed up there, it would be funded at roughly 50%, and this position would report to the director.
And is that salary plus benefits, or is that
That's just
raw
salary,
Okay.
just raw salary.
salary.
Right, I did not get into all the benefit stuff.
Just want to make sure which exactly we were looking
Yeah,
at.
and that's what you're gonna look at with all these. Now, on the pages in your budget, you do have the benefits section added to that, but I did not do that on this piece. So now, our social worker 3 for guardianship, we have seen a 91% caseload growth in our guardianship requests. The caseload standard is 25 to 30, and we're talking like over 5 years. Currently, we have 2 full-time equivalent individuals. We have 1 full-time and 2 part-time who are doing this kind of work. We had 88 guardianship cases at the end of the year. A lot of these cases in the good old days, the lady you see on the right-hand side of the screen, she would be very much an example of the kind of person, an elderly individual who can no longer plan or take care of themselves. Today, because mental health used to have a lot of these cases, mental health no longer handles this kind of thing, and so we are also serving as guardian for a significant number of younger individuals with major mental health needs. So we're asking for 1 position to get us more in line with what the caseload standards are and to allow us to better serve these individuals.
I thought the courts handled that, all of that.
The court does the decision based on the petition, but we provide all of the legwork that makes that, because once they're declared incompetent, if there's nobody, and we only do it if there's nobody else that will do
I
it.
was a guardian, so I'm very
Right,
familiar
right.
with what takes place
Yeah,
there.
so,
But I didn't work with social service at all.
you don't have
And I
to,
was in charge of it the whole
Right.
shebang.
you don't have to, but we
That's
have
right.
88 individuals that do not have any person who can serve as their guardian, and we are the guardian of last
So
resort.
you take over completely for the
For those-
spending of the money and,
Yes, sir, if that is what needs to be done. We are generally guardian of the person in some situations, but very few, we are guardian of the estate. But primarily, we are guardian of the person, because most of our folks don't have money other than their basic Social Security or SSI. Okay, so it's making sure they have housing, making sure they get their medical needs met, making sure that all those kinds of decisions and activities occur for these folks.
Do you keep statistics on the numbers and the count if you get more?
Yes, yes,
So
ma'am,
that
we
you can do
track
some
that
comparative.
every month. That's why I say we know that over the last 5 years, we've had a 91% increase. We had 55 cases a few years ago. We now have 88. So you can see how that has grown. It's grown significantly. And again, the individuals have so many more service needs because they're younger and they're mentally ill than we used to have when we were talking your basic aged individual.
in other words, you would take that individual and you would be responsible for putting him in a nursing home?
Or making sure that he lived independently in the community with supports. Yes, sir.
Yeah. Well, that, the support, that's where well, we won't go there.
Yeah, so, again, the salary, this would be a social worker 3 position, and that would be the salary, not the fringes. Okay? The refrigerator is an example of some mental health issues that someone had, because they write all over the place sometimes. Yes, ma'am.
I'm just curious. What would you say the reasoning is for this significant number? I'm just quoting this sentence here. A significant number of today's, that you've just said, are younger with chronic mental illness or diagnosed with developmental delays. Have those people always been here, but now there's more provision for them?
Formerly handled by mental health.
Right. Mental health served as guardian for those individuals in the past, and when the mental health program transitioned to the LMEs, the management entities, the law was changed so that DSS was the only public guardian remaining.
So now, I'm going to show the tourist in me. LME stands for?
The management entity,
Local
local management
Local
entity.
management, okay.
Is that just Pitt County's the district
That,
on this? You know, we have, how many counties do we have in that district, Scott?
Currently, you have 19, but the LME represents those 19 counties, is going to merge with coastal care towards Wilmington, will be a 29-county area. It'll be one of 4 LMEs in the
I think
state.
it is,
Yeah.
I think it is.
And they manage services across the state. They don't do
Yeah.
direct care
They- right,
provision
right,
anymore.
right.
The direct care provision went away when the mental health centers that were government agencies went away.
I had a doctor to come to see me, but not going that far. But how much money do we put into that? Does the state put it all now?
Well, counties contribute some portion of it, I think the majority of it is state dollars. And one thing about the 29-county arrangement coming July 1, they're gonna have 3 sub-regions within our LME, and they'll have an overall arching board that will guide the operations of the LME. They'll have 3 sub-regions that will feed into so you have 3 smaller boards and 1 big board. So there
Right.
will be some local, and there will be a regional director as well.
Uh-huh.
Our region.
All right, the houses that we have out there on the county land, what, 2 or 3, all right, do they control those houses or does the county?
Those are, well, one of them is actually office space for the LME, the other 2, I believe, are group homes, and those are contracted with a mental health provider in town who falls under the umbrella of the LME, who guides those services and the payment of those services.
I guess this is where I'm going to. What part does social service play in this? None. I didn't think they did. That's what I'm,
Those 2 facilities are just rented by a provider.
oh, yeah.
That
That's
pays
where,
rent to the
and they
county.
that's the reason a lot of us were so much against us losing mental health, because we knew that when it got out that we would lose control of that. Okay, go ahead. There's a lot still to learn, though.
So, yeah, so this is our request for guardianship, a social worker for guardianship. So now we will move on to our next position request, which is for our protective services caseload. This is abuse, neglect, including self-neglect, exploitation of the aged and disabled. We have seen a 53% caseload growth. The recommended caseload standard is 25. There has been no staff growth since 2000, and in fact, the staff growth we had in 2000 was a position that Vidant funded to help with the issues that present over there around this. Again, the salary would be $43,000. We were recently monitored by the state, and we are having difficulty. We're doing good, but we're having difficulty meeting our timeframes just because we don't have enough people out there doing the job.
Have you checked with Scott on all these positions that's in the letter?
What we're doing is presenting to you guys, then once you amen whatever you're gonna do, it will go to the county manager for him to decide what will or will not make it into the county budget. That a true statement?
The first positions I've seen.
Okay, so that's adult protective service. It is a really critical problem. And one of the things that we need to know is right now, today, although we could have a protective service case with a younger person, right now, and the data's in your packet, I can't remember, but there's a huge percentage of people over the age of 60 in Pitt County who have 2 or more medical disabilities. And by 2030, we will have more people 60 and older in Pitt County than we will have under the age of 17. So we are rapidly moving to a direction that we may see more growth in these kinds of
It's
service
nice
needs.
that we're living longer.
It is good.
Good health.
So, moving right along to our last, no, not our last, next to last position request. We've vacillated on what to call these folks. We've called them human service resource aides, we've called them transportation aides, but basically, the bottom line is, we are asking for 2 people to help us with transportation needs. We are talking about foster children. We are talking, and for foster children, it would be medical appointments, family visits, take them to school. These kids get kicked off the school bus, and it's their parent, more or less, we're responsible for getting them to school if the foster parents cannot. This would help our guardianship clients do their grocery shopping, pay bills. We're talking about things that you can't just put somebody on a bus and say, you know, go forth. Somebody's got to be with these individuals. This would allow our social work staff to focus on really critical needs. It would reduce our overtime, we believe. We have what we call B-duty social workers, and these are the social workers who work after hours to cover foster care visits and those things. These could be the people who could be doing this instead of those social workers. We spend a huge amount of time as social workers running people up and down the road, and it has to be done. It takes us away from those meaningful activities that can really move those cases toward the desired outcomes. We had these positions in the past. They were very important, but as people retired and the budgets had to be cut, these were some of the folks that got positions that got cut. We believe strongly we need to bring these positions back, and we do anticipate them working a staggered schedule so that we don't have to do the overtime piece, or very little of it. And the salary in this situation would be $19,496.
I have a question on
Yes,
the
ma'am.
qualifications here, and reading the job description and looking at, the information on qualification. And since these are children who does not fit normal activity, rather than problem, people that get kicked off the bus and everything. So, children that do not fit in the normal pattern of children. This one person may be driving. Is it one individual at a time or more than one at a time?
More than one child at the time, or more than one. Sometimes, I mean, we could be taking several children to visit with the family.
Is the question here, because I wanted to understand that, is someone, having driven a bus, you can't drive and pay attention, because some children unbuckle the seat belts, and they do this, and they hanging out the window. So do you have someone on the, what's this?
If that would be needed, we would have somebody go with them. Typically, our social workers drive them by themselves. The children, we do have some children that we would not trust to be with one person by themselves. But most of our children are typical children as far as, you know, being able to buckle them in and
Because I
go.
was worrying about liability and problems of
Yeah.
something happening, we looking bad.
Well, our social workers are running up and down the road by themselves doing the same things.
And I think that this request is just absolutely necessary.
Yes, it
And
is,
I-
but you know.
And I found that a lot of times, especially following visitation with the parents, when the children had to return to their foster homes. Okay, the social workers are usually the bad guy at that particular point in time. Having a transportation aide, she became more like their friend. The children were so much more responsive to her, like taking them home, whereas if the social worker, as in I, tried to take those children home. I mean, I have had a carload of children kicking the back of my seat, kicking the front dashboard, being held, and I mean, sometimes would even take another social worker to ride with me to contain. Whereas a transportation aide, there's just something about them, and I think that they would be very discreet in choosing the right one for that job. I don't know, it's just like they become a savior to the children. And liability, they're under more liability with social work than they are transportation.
Well,
agents.
I was just looking at that because I was
Well,
concerned.
it's a wonderful
And I didn't
question.
want to call them trouble children. I wanted to put a good name. to
They
the
can
children.
even be wonderful children, but when they get taken away from their mamas and daddies after a visit,
They're not
Ooh.
happy.
Yeah, okay, thank
I'd
you.
be the same way probably.
Yeah, exactly, we all would. Okay. Okay, the last position we are asking for is the program integrity position, and we've had a lot of discussion about program integrity last month, so I'm not gonna dwell on this a lot. We've had, as you know, a 22% growth in our public assistance caseload, which is what would be feeding, the program integrity staff. We have 300 potential claims right now waiting to be worked. And again, last month you saw that 136,000 was collected in claims. The salary for this position would be 32,000. And I haven't been saying this for any of them, but basically these are all cost allocated roughly at about 50%, all the positions we're asking for. This position, in addition to having the claims that we're collecting, their federal salary, we do also generate revenue from this because we get some incentive dollars for collecting on these claims. So there would be probably a little better reimbursement rate if we can generate more collections. But that is our request. The rest of the budget is pretty much what we have done every year. It's the same, do a fourth of the,
And that's kind of where I wanted to go, especially for Coral's benefit, because the premise that the county operates under is you sort of have your base budget. And so what she's bringing us is additions to that base that she plans to carry forward if we so bless it. And in the county, all the department heads meet with the manager and the CFO and review it. Manager makes his recommendations up to the full commissioners, and select department heads, like Jan, who reports to a separate board, then have the opportunity in those workshops to take her concerns forward, where she can bring up the caseload increases or the why she thinks these staff are important, and if the manager for some reason didn't recommend it up, she would still have that audience with the county commissioners to bring that forward.
Yeah. I spoke with Jan a while ago at the beginning, and I'm the new kid on the block, and I'm the inexperienced one dealing with all this important budgetary. And I wondered if there was a possibility of a workshop or something where we could kind of sit down and look at things. I wanted to ask Gwen if this covered just one staff position, because I know last month I was totally blown away by 2 people with that kind of responsibility and being overwhelmed. Does this program integrity staff only cover one
position.
additional person?
Right.
See, right now, I'm seeing where we should give her more than just one more person, and maybe there's somewhere in the budget that something can be streamlined in order to create funding from more than just one added investigator. That's what I would appreciate, having some sort of a workshop or something where I just feel a heavy responsibility with taxpayer funding and wherever it's coming from, to know that I'm really approving something that I, on further thought, would have had second thoughts about.
Well, and I'm not against the idea of a workshop. We are recommending it up. We are not, what we do may not look like what comes out at June 30 because of the process of it going to the commissioners. I also think at some point, we hire a professional director to request the resources where she thinks she needs them, but also she has to temper that with the direction that the manager gives all the department heads on what he sees as tax-based growth, remembering that this agency got the lion's share of staff that was in last year's budget. I think we just have to sort of be cognizant of all those things, because on the heels of a year where they got 30 positions, to go in and ask for 10, no matter how justified they are, I don't know that realistically you're gonna get them, and I see Scott looking at me, and I got the nod there.
Well, if this is our Christmas list, can't we just add a couple more for Christmas for Glenn? You know?
And having had
Yeah,
one former
I can
commissioner
tell
and
you
one
this.
current commissioner.
You've already got a 3 point something increase in your budget. Now you're gonna come back with this. They're gonna, and we might as well face it, they're gonna look at that. So what we had better do, we had better look at priorities. If these people that you are recommending that we really do need them, then let's look at somewhere else where we really don't need them, so to speak. You follow me?
Or just even other expenses that might be, you know, possibly taken care
That
of
we
from
can
other
cut back
venues.
so that we can get
Such as
these
maybe, you
people.
know,
That-
charity
that's just very
venues or
simple.
things like that. It's things that this is, when I received it's kind of overwhelming, and I'm not an accountant, and,
Right, and I, much
but I'm
as,
glad, I think every one of these that have been brought up here today are very needed and very beneficial. And, but I would like to add at least 2 more.
Visions of sugar plums, just
right, well,
dancing in
and
the
I
air.
hesitate to get into the weeds, so to speak, of what I think is Jan's job, and that is to have already analyzed office supplies and travel and overtime and to bring forward what she feels is critically important, and that's the big picture. I don't want this board to, and not that you're trying to micromanage, but I don't want us to get in and try to redo your job for you when you're already meeting with your staff and that sort of thing. I liked your presentation today. I liked that you pointed out it's Northwoods, it's general assistance, and it's these critical positions that were not addressed last year.
And
They're
it
in
has-
other areas.
And it's never been spelled out like so, I must say.
And I don't know whether as the chair of this board, I can make motions or if I'm supposed to be ceremonial. But I like the way you've brought it forward, and I think you've addressed the big items that were not handled last year when we got intake and services and, or, you know, the piece that Brian is trying to get on board and bring them, you know, up to speed. Could you use probably 4 transportation aides? Could you probably use 4
Integrity people.
integrity folks? But again, I think as a board, we have to realize we got the lion's share of the county positions last year and go in with too big a list and everything could be cut because, oh, they're not realistic, they ask for too much. I think Jan can do a really good job of supporting these needs and getting support for why these will, you know, these need to stay in the budget.
And I will say, we started with 10 and down to 6 now. I think Mr. Manager
I'm
has something.
sorry.
Yeah, I was going to interject. Last year, during the budget process, maybe right after, one of the commissioners had asked a lot of detailed questions about the DSS budget. And it is a very complicated budget dealing with federal, state, and local dollars. And it's been very hard in years past to put our hands around it in a very concise manner to try to explain it. I will say last year, a report that was given to the Board of Commissioners about the DSS budget was broken out very concisely with those 3 pots, all the different program service areas, matched it back. We can get you a copy of that. That might be a good starting point for you to go to the whole board to look at and then.
And in
I
your
would
package-
appreciate input from, just because you are so knowledgeable. And I agree with all of this. And I just, you know, one of the things that could be a workshop possibility was, you know, as thinking about these integrity investigators, as they, you know, bring things to be, you know, brought to court or whatever, if that's a savings to the county because these people are no longer able to initiate fraud, could those savings be put in some sort of a fund that would help to pay the salary of additional, you know, staffing later? You know, as they are successful, that would be a way to nest egg to bring more people on board. But that to me could be a workshop, kind of a brainstorming
You think the county manager will let us keep those monies for the savings?
Oh, I just know he would. I know, I just know so.
And
Elliott.
$22,000 they brought
anyway.
in this year goes to offset the cost, right?
Miss Elliott,
Yes,
if I could interject, that breakdown that the county manager was talking about of the federal and state and county, if you'll look, it's
saw it.
towards the back. It's actually called the Form 1047.
It's
That form?
behind the purple sheet.
Yes,
That's-
yes,
Cause that's the part that I was complimenting on. I just loved it.
okay.
I
But
just
that's
also
all of your
mandated
programs.
services.
And that's all of your that's everything broken down by federal, state, and county
Plastic.
from our budget estimates that we've received from the state.
This is it.
Scott, do you have a percentage that, a breakdown about what each department is gonna get? What you will be looking at? And of course, I know you have to have something in your budget.
Well, as Ms. Bryan was saying, the commissioners have developed this base budget process in terms of budgeting. We will look to adding to expenditures to the budget as revenues come in to support those. In lieu of looking at a tax increase, I mean, that'd be a separate part. Looking at national growth in the tax base. So right now, budgets are not due until, this coming, well, actually, they were due to yesterday.
Yeah.
I guess they're not. We haven't compiled all those, we do not have all the tax base estimates. I will say that one thing the commissioners have coined is to concentrate, focus on what they're calling human capital rather than bricks and mortar capital like we've done maybe in years past. And by human capital, what they're trying to say is that over the past 4 or 5 years during the recession and coming out of it, we've given no merit or pay for performance increases to employees. That had sporadic cost of living based on a CPI, but those have not been much due to the CPI being very low. So out of the lion's share of the growth that they will experience coming into this budget, the majority of that will be recommended to the board to be spent on those merit increases. That will leave probably little to nothing beyond that. So it's, do we give our employees the opportunity to get a 2.4 or 1.2% merit increase, or do we look at expanding positions and services? Right now, the board's saying human capital in terms of we need to reward, especially in DSS, you look at all the overtime and the effort that your folks have put into the NC fast conversion from the nursing, as well as those in public safety, as well as the entire workforce that deserve to be compensated with merit pay.
and that is included in the money we have factored into this budget now. So
Part of your 3.2.
that's part of our increase.
Well, can I make a motion? Sure. I'd like to make the motion that we accept and endorse this beautiful piece of handiwork that Mrs. Elliott has prepared and let it be presented to the commissioners and to Mr. Elliott, as is.
I'd like to second that motion and commend her on the presentation.
Exceptional.
So moved and seconded to support you in carrying this forward. In light of Coral's concern, maybe meet with her individually right now to better understand it. But I think the workshop or the retreat like we held in the fall, you plan that as an annual. Maybe the fall is a good time to start looking at things like this so that we are way ahead of the county's budget curve
In planning.
instead of right now when it was due yesterday kind of
Good idea.
budget curve. Does that work? And we add, so we start looking at caseloads and percentage of growth, and we're thinking early on what we may want to do and how we can best afford you the opportunity to get those things in the budget, and add that to our fall calendar when we do that retreat, that planning retreat.
That gives you hope, doesn't it?
That would be enlightening to all of us.
Right, right. But I can certainly meet with you
I would
privately.
appreciate it. Okay, so all those in favor of,
Let me make a comment. I'm a taxpayer in Pitt County, and I represent, well, I don't represent you, yes, I do too. But to me, taxes high enough. And if it's gonna up my taxes, then certainly, I believe in getting the most from personnel that you can get, Melody. That's what I do on my phone. And I can't get everything I want.
And
And we
Mr.
can't get everything that we want here.
And we
And
recognize,
we know there's a big need for it. It's not, there's no question.
but if we don't illustrate that need to the public,
but-
we have failed in our job as this board supporting the department.
Right.
Yeah.
While we
Well, it all depends. I'm
recognize-
gonna support it.
It may not ever come to pass. We
But-
have to let
the-
our staff tell us what's important.
Right, but at the same time, I want us to work with Pitt Community College. I want us to do those things that need to be done so that we can get the most from our employees, and we got to do our part. And I don't know what we're doing that or not. So that's where I don't know, I don't have the answer to it, but,
We got a motion.
you'll never get all you need, so let's put it that way.
Right.
Is what you,
But we are
you're
encouraging
ne- oh,
Jan to at least make sure she's telling us what she needs.
yeah, oh, yeah, well, that's what we hired her for.
All those in,
And as far as this budget goes now, this thing you're taking now is to approve this budget the way it is, as is that
It's-
correct?
it's for Jan to take this forward as her submission to the county manager. Then the county manager massages that, and it may look totally different when it goes forward to the county commissioners. And the process is, for the next month or so, Scott is putting DSS and public health and all the departments together to compile it into a bigger budget that then goes to the county, and there's a week of workshops where they go over the departments, the tax rate, the growth in the budget.
And what, does that happen like the 1st of June or
That
something?
happens actually typically in May for a week. Every day they'll meet. And then after that, Scott and his staff go back and make any changes they're directed to make. And then it goes to the public for comment. I think you all are set on June 9th now?
And
I
then,
can,
and
you
then
know, I
does it
will
come
vote,
back to us? at
I
any
will vote
point?
for it, but I've got a sense enough to know this. He said, I've never known to come back what wasn't cut out.
Agreed. We're
So you're
just,
gonna-
all we're saying is she takes this forward. We're not saying this is what
Oh,
Scott
I
will
know that,
approve.
but at the same time, we need to be prepared to make the cuts ourselves that will hurt us the least. Do you follow me?
It'll come back to Jan to prioritize.
Right, it will come back again.
Okay.
And we're the ones that need to be, that's where we need to be more involved pertaining to that. So that's,
So there's no, like, we wouldn't have like a workshop time this time,
no.
but you're saying going forward that we could, we
this
could
is act-
include
this
that as part of
proposal-
our retreat, and I think that's a wonderful idea.
Because
you
this
know what
proposal
growth
was
you
actually
got?
due to the
Yeah.
manager yesterday.
No,
Okay.
You do
All
not
the
know that yet.
departments.
not to say, nothing could say publicly on that. We're expecting some growth, but I don't have the numbers in enough to make a, to tell you it's 1%, 2%, or
20%.
Oh, we know it's gonna be more than that.
I just think we're called to be good stewards, and I want to, me personally, I want to know that, you know, that I'm dealing on a good basis of knowledge, and you all are part of that basis for me. Thank you.
Now,
I agree
this is
with you
going forward with the
100%.
corrections that you made, okay?
To the manager, who then will
Right,
massage it with Jan, and something different may go forward to the,
And one point, even
commissioners.
though I massage it, because I have to make the expenditures fit the revenues, the board will see, board of commissioners will see from every department, whether that department gets to come forward in this room in a workshop, or whether they come forward in a written form. They'll get to see the original request, they'll get to see my recommendation. At the end of the day, then the board decides the final, what's adopted. Sometimes it's the same as the original request, sometimes it's not. There's give and take and board direction and such.
so all those who support Jan's budget submittal moving on to Scott, or the DSS budget submittal moving on to Scott,
With the changes.
with the changes, let it be known by saying aye.
Aye.
Okay, thank you. Director's report.
Okay, we'll try and make this quick. The vacancy report, you have that available to you. You see the 9 IM caseworker 2 positions, those are the last 9 out of the initial 28 that were offered. or provided last year, they have now been unfrozen, and they will be posted shortly for recruitment, and they will be going into our review caseloads.
Because you did staggered hiring.
We did staggered hiring so that we could get the training to work that way. We couldn't bring all 28 in at one time and get them trained and everything done. So those are about to be advertised. We are advertising several of our social worker positions, and so you can kind of get a sense of what's going on there. There's some that we're still on hold for the short term. The overtime report that y'all have been asking for, you can see what the overtime was in January for the Medicaid backlog and the February Medicaid backlog. You can see how many workers this involves. And so for February, we had 1,300 hours and I've rounded it off, 1,300 hours of overtime. The total overtime for January and February for Medicaid has not been paid yet. It will be paid, and that would be roughly $47,000, almost $48,000 in overtime costs. The child welfare backlog, the hours there are 304 hours for February. They have already been paid for that. We are evaluating that on a weekly basis now. And we are very close to that one ending, I believe. And Gwen and Margaret could fill you in if you've got any questions there. What we were doing here was workers had gotten really far behind with their dictation because of the fact that they had so many vacancies and a variety of things. Also, there were a fair number of cases that we were through, but we hadn't actually done the case closure zone, so they're getting that done. So those are those two reports. The other things that I have to report is at your place when you got here today was my director's report for the month of March, just to give you some ideas of things that are going on. I do want to point out that I have put the strategic plan on hold temporarily because staff were so overwhelmed that nobody wanted to participate to any great degree. They just were doing too much, and so we've agreed to hold that off until spring. The other thing that I wanted to point out here is that the customer service survey, I was going to present that tonight, but decided that there was too much going on today and we would hold that till next month for y'all to take a look at, okay? Also in your package, and these were not things that I planned to discuss, it was just a matter of sharing with you information that's been shared with other people, so they were at your place when you got here today. The first thing is Commissioner Webb had asked for some more information, so I have provided that information to you that has been provided to him so that you would be aware. A letter went out from the county manager's office about how folks are appointed to boards, and so that information is in your packet, including a board appointment form, and the whole process is discussed so that you will understand or have that information. There is a child support shout-out. We had one worker who did a significant amount of child support back, got some back payments done, and she was recognized statewide, so wanted y'all to have that.
Two cases in the top 20.
Two cases in the top 20 for the state, So that has been done. That was Christina Carter, so we're really proud of what she got done there as lump sum payments. March 27th, you have an invitation in your packet that looks like this. For those of you all, it was a handout.
Okay.
That is talking about a listening session. Pitt County was one of 10 counties chosen by the state to have this meeting. We are doing this on March the 27th. A variety of folks from the state will be coming down, and a lot of the community partners and our own staff will be talking together about what's going on in child welfare in Pitt County. Our legislative delegation has also been invited. This is not a public meeting as such. It is a meeting by invitation only. And so we're looking forward to having that dialogue with the division and the department.
My question is, does it fit into our calendar? Because, I've been trying to work hard to keep my calendar right. Does it fit in?
I don't know if it will fit into that calendar or not. It's a Friday afternoon on the 27th at 2 o'clock. So if you can attend, we would certainly like you to attend. And then the social worker luncheon that's tentatively scheduled for March the 27th, also to recognize social workers for Social Work Month. I don't think that's been finalized yet, but you will get an
It's
invitation to
gonna
that.
be on the same
It's the
day,
same day. Tentatively, that's the same day.
2 items, and, but
You can
don't
spend
have
the day with
timetable.
us. I do have the time for the listening session, that's from 2 to 4
Right.
at the
But
church.
you don't have the other one.
The other one, I don't know exactly what time they're planning to start that luncheon, probably around 11:30. And it will be at the Agricultural Center at this point, but it's not finalized yet, but you will be getting that. Yeah, it's at Cornerstone also? Okay.
Both of them's at
Both
Cornerstone?
of them's at Cornerstone, so they hadn't told me where the other one was, where the luncheon was. Okay, so you can just spend the afternoon at Cornerstone. Okay, so those are the things that I had from my report. Anybody got any questions about any of that? You do have, by the way, your survey in your packet this time that hadn't been there for the last packet thing, so just wanted to point that out to you. And I can do the integrity report. You have the program integrity report in your packet. If anybody's got any questions, you can see that we had $10,000 in food stamp cases that we have set up claims against. We do have one case that will fit our new policy about referring to law enforcement, and it's a $4,445 case. That one will be referred. We also have some cases that were agency errors there on the back of the piece of paper. And we are sorry whenever we see an agency error, and there are several there in the amount of $9,248. But the staff, the client, unfortunately, when it is an agency error, just like when it's with the IRS or anybody else, the client does have to repay those dollars because they received those benefits in error. They were able to make use of those benefits.
I would like, maybe this is a good point for me to bring up a concern I had. Donations that were given for the holiday cheer.
Right.
There were, I know it happened to me and another person I know that donated and let me know that the funds were not dispersed according to our wishes, and we had to bring it to the attention. So I think it's just a good idea. Everybody is so overwhelmed. Sometimes it's hard to double check,
Okay.
to be sure that you check the stub of the check, to be sure that the donation is actually going to, allocate to what that donor is wishing.
If you
Just
can
a
let me know
matter of
about that,
double
we'll
checking.
follow up.
Yeah.
You want the memo?
Yeah, just looking at memo on the checks, to see that it's actually being dispersed to the correct department where it was noted.
I'm not gonna,
We'll talk some more
I'm
about
not gonna say anything about it today, but eventually, on this from Glenn Webb, on it, $148,000, I'm gonna want some answers pertaining to that and for Pitt County and so forth, but we don't have time to even get into that. so,
Okay. Okay.
But it's very important to me.
Other comments from the board? Do I have a motion to adjourn?
I move adjourn.
Second,
So moved
You
and
don't have to, you
seconded.
don't have to worry about that.
third and fourth.
Thank you very much.